And good evening, everyone. ESS, Empire State Sports, proudly presents the Wise Guys Sports Talk Show with your host tonight, Joey Riem, Dave Bartlett, and myself, Pete Ghostlaw, and our special guest, Paul Ghostlaw. Welcome to the program, Paul.
Hey, thanks, guys. I appreciate it.
And no surprise that we have the same last name, folks. It's very, very rare name. So, yes, he is my brother, younger brother, the middle one of the group. And we might get into that later too, but you never know. But anyway,
probably the smarter one too.
Obviously, yeah, definitely the better looking one. That's for sure.
So
I
don't know about any of that.
I didn't hear him.
I said I don't know about any of that. So.
Oh yeah, okay. So let's go back a little bit.
Hey.
So, let's go back a little bit. Paul Ghostlaw, Salmon River Central graduate, just like David and I. Section 10 boy, played 3 sports, played soccer, basketball, and baseball. Noted more for high school basketball, 1,000-point player at Salmon River. Joe Kukowski Award runner-up his senior year. MVP of his senior year for Section 10. Back then it was divisions and not like we have now, so it'd be Division 2 we were in. That's a little highlight. And then Paul moves on to Ithaca College, which we've had quite a few people here from either Ithaca or Cortland. So
that's the one you go to when you can't get into Cortland, right? Is that what they said?
Yeah, that's what everybody said. Yeah,
I'm just repeating what I heard. I don't know.
No, the actual joke is that Cornell. People think that Ithaca College is in Cornell, New York. So obviously Cornell's in Ithaca, New York, and Cornell is high above Cayuga's waters. That's their motto. But we are actually higher above Cayuga's waters. So
yeah,
okay.
you're up the hill. Yeah. You're up the hill, and everybody I've asked, Paul, I've asked them if they knew Rogan's, and everybody says yes. I know we've had many pizzas from Rogan's there up on the hill, so.
Pretty good pizza place.
Yeah. So, Paul, we're going to let you tell your story about from going from college to, from high school to college, and you start us off from there, and then we'll move forward.
So, like every other schoolboy kid, we all have that dream of playing professional sports, and I think it gets to a time in your life, whether it's earlier on as a freshman or you get to be a junior, and you start to think, well, I don't think I can play professionally. You know, it doesn't look good. Even though the dream never goes away, you come to a realization that you better find a line of work that you're happy with. And so I'll be honest with you. One day, Craig Richards' father, Warren, took me aside, and Craig, whether he watches it or not, but Warren took me aside and said, what are you going to do? I said, I don't know. I said, maybe, I like sports. I like to use my mind and be creative. He said, well, what about physical therapy? And this was 1985, and I didn't know what physical therapy was. So I took the idea, and I went to Malone Hospital, Alice Hyde, and there was a physical therapist there that our father knew, and he was able to allow me to shadow for a couple of days in the hospital. And for all intents and purposes, it was it was fairly archaic physical therapy compared to what we do now, but it was still muscles and bones and tendons and ligaments, and I thought it was pretty cool. So I took the idea and ran with it, and 35 years later, I'm still doing it. So I applied to Ithaca and a bunch of schools, and Ithaca was high on my list because they had a great physical therapy program. And I got in and showed up there in fall of '86 and went from there.
So you did. I want to give everybody a little history. You just didn't stop sports after high school. You did make an attempt to do college sports, but realized You need,
Well,
there's more
yeah,
there's more than sports. You have to have that career.
Yeah, I think even at the Division III level, you learn that it's extremely competitive. Even nowadays, Division III sports is very competitive. And so I walked on the basketball court there and figured, hey, you know, I had a great high school career. I could play, but I'm a 6'2" center. And, you know, I used to go up against Dave and, you know, we probably came to blows many times when I was a freshman and Dave was out of school. I remember him coming home from Cleveland. I get, and but I realized, man, I'm 6'2", and these kids are 6'7" and 6'8", and so I had to learn a new position. I'd become a shooting guard, which bettered my game, but I quickly realized I was falling behind. So I made the team, and at that time there was a varsity and JV team. I don't even know what Division III does now, if there's just one team, but made the team. And I remember it like it was yesterday. I got a 56 on a chemistry exam. And I went into the coach the next day and I said, Coach, I'm done. I didn't come here to play sports. I came here to get a degree. And it was a hard thing to give up sports, but that's what I did. I got my social life together. I got my academics in gear. And in the spring, I tried out for the baseball team. Figured, hey, I was, you know, a great baseball player in high school. I'll give it a shot. And I made that team at Ithaca. So, and the funny thing is, I remember going after tryouts and making the team, or actually kind of during tryouts, the coach said, okay, what do you want to do? I said, well, I can play third and short and pitch. He says, well, pick one. I said, well, what do you mean? I can do it all. He said, well, not at the collegiate level. You either have to pitch or you have to, you know, field and be a hitter. And I probably made the wrong choice. I became a pitcher. And that was probably the end of my career because I realized throwing in the mid to upper 80s isn't enough at the collegiate level. And so I played that year. I tried out in the fall again for fall ball at Ithaca. This would be going into my sophomore year. And whether or not I could have made the team, that's who cares. But I did not make the team. I got cut. And they went on to win the national championship. So probably my cutting allowed them to win the national championship.
Yeah,
I could get something
You were holding them back.
for that.
Yeah.
Yeah, exactly. But that was quickly, my sophomore year of college was quickly the end of my athletic career. But I still had the dream of being in sport. And that didn't stop me from playing, but I realized that I, as a physical therapist and as a healthcare provider, could be on the sidelines, or could be in the training room, or could be you know, somewhere in between of getting these athletes back on the field or get back on the ice or back on the court. And that's kind of where I took it from there. And you know, I watched. There was a guy that really I followed in high school. I think Dave was a 76er fan. I was too. And one of the minority owners of the 76ers was a guy by the name of Pat Croce, and he was a physical therapist. And he had built this little empire around Philadelphia. And he sold the empire and bought into the team. And I realized, wow, he not only was he a physical therapist, but now he's a minority owner or majority owner. I don't know where the chips lay there. But I realized there was a lot of opportunity in what I could do as a physical therapist. So that's what I did, and I was able to get a degree and move on.
So you took
Not to mention your athletic career. Don't you have a couple of nice scars on the knees that might have played a part in ending your athletic career?
All those knee surgeries, I've had a number of knee surgeries now. All those took place after college. So
Okay.
yeah, it took place in my mid 20s to late 20s. So that really put a stop to basketball. I still play every now and then, but there's no rim hanging or anything like that anymore. So
Yeah, you and me both, buddy. You and me both.
just quickly.
So Paul, you did your internship. I remember that trip immensely when we went down the city. You did an internship here in New York State after getting your boards. and then you moved on to Boston. Why don't you tell us a little bit how you started off in Boston? Because you were in town a while working for other people, but always behind the scenes you were wondering, I got to open up my own place eventually here. So why don't you go ahead and tell us a little bit about that?
I think like any other business, yes, I've always been that capitalist entrepreneur, whether I was selling corn or whether I was painting people's homes, or I always wanted to try to do something a little bit extra and try to work the angles. And I realized that there was a way to make a good living, or to make a better living if I had my own practice. So I had to learn, number one, how to be a good physical therapist and communicate, and number two, how to market myself. And number three, I had to be around other people who were successful and learn from them. And that's what I did for many, many years. I tried to be alongside better physical therapists, people who were better than me, and learn from them. And then I surrounded myself with good business folks who were astute, not in medicine, but in the field of running a business. So I don't have an MBA. I don't have any type of business degree. But I learned how to cut corners, and you learn by spending a lot of money too. Probably would have been cheaper to get my MBA, but you learn by failing, and that's what I did. But it took many, many years. Probably about I started my own business in 2011, so it took 11 years to really open my own business. But during that time, it's a lot of saving money. Learning on the ropes, educating yourself, staying up with the current medicine and the current approaches to treating surgeries and treating injuries. And then one day you take a stab at it, and I did in 2001, and I haven't looked back yet.
Yeah, and for everybody that doesn't know, you actually have 2 clinics going in Boston area right now, correct?
Yes, but as anybody who has run a business or owns a business knows, you cannot do it yourself. And I have outstanding folks that have worked with me, have worked alongside me, and currently work with me. And it's a team approach. You cannot win it by yourself. So we have to have a good team. We have to be on the same page. And medicine is changing. It's much different than it was 20 years ago. Much different than it was 10 years ago. So you have to learn the ropes and learn on the fly, and that's what makes it really interesting and frustrating at times.
That was my next question. Exactly how far has this progressed in your field from the time you started till now? I'm sure a lot has changed.
Well, let's put it this way: a total hip replacement. When I graduated, a total hip was hospitalized for 14 days. A total knee was hospitalized for 10 days. Now, there are some surgeons in Boston that are attempting to get the patient home the same day. They're really trying to force that issue, but most of them will stay a night or two in the hospital following these total joint replacements. So that's how fast and accelerated medicine has become. Your ACL reconstructions were casted, were mobilized for weeks, and then they came out really stiff. Now, we're getting ACL reconstructions on the bike in a couple weeks, and it's just really accelerated. It's really fast, and if you're not fast and if you're not pushing folks, you'll hear about it. Patients want outcomes, so.
How soon before they're out of the hospital or after operation are they actually seeing you, Paul?
I have had one patient in my life who had an ACL reconstruction in the morning, and the surgeon wanted him seen that afternoon. So I was able to get him in that afternoon and start care. He was not very healthy. He was white as a sheet, very nauseous. Most of my ACLs come within the first 3 to 7 days, sometimes within 2 weeks. Total knees, total hips, total shoulders will come in the range of 3 to 4 weeks by the time they get to outpatient physical therapy. So they're doing physical therapy at home, but by the time they get to us, it's probably 3 to 4 weeks where they're safe to leave the house and come in to see us. And then all your other surgeries, runs the gamut. Some are a week, some are 2 weeks, some are 4 weeks. The surgeons vary a lot with the protocols, so we have to, follow what they say and what their wishes are.
So just give us a little background. I know every situation and scenario is different, but take us through a physical therapy rehab with a knee, with a torn ACL. Tell us what you're basically the steps you're going through to.
Whether it is a professional athlete, whether it is a college athlete, or whether it is a 37-year-old female who wants to play tennis again, your primary goal as a physical therapist is to reduce swelling. So that's the first thing we got to do. We've got to minimize the amount of swelling in that joint. Then we have to get their range of motion going. And there are a number of ways to do that: active exercises, passive exercises. And then you have to fire up this leg. You have to engage the quad, engage the hamstring. You have to wake up these muscles that have been fairly quiet following surgery. So you want to be as active as possible, but you have to take into account that if you're too active, you could stir things up in the joint and actually set the patient back a week or two. So it's a fine line that you have to draw, but once you've done it a couple hundred times, it's you kind of figure it out. And you failed along the way somewhere, but you've done it a lot. It becomes, I don't want to say easy, but ACLs I think are the easiest thing to treat. Some of these other surgeries where you have to wait 6 weeks to get them moving, and you have stiffness. Those are a little bit more problematic. So,
Paul, is that?
Go ahead, Dave.
Go ahead, Dave.
No,
Okay.
I didn't.
Joey?
Okay. Yeah, I was just going to say, so the first thing that you talking about the ACLs, that because that seems to be the most prevalent injury for the most part when it comes to most sports, and in the timeline now has just changed so much. Where it used to be, boy, he's going to be out a year to they're coming back. I mean, certain professional athletes are coming back as quickly as 6-7 months now. Would you say?
Yeah, well, I think what we're learning, we as healthcare providers, sports medicine, physical therapists, trainers, we went through this phase where we were very slow in the 90s to a phase in the early 2000s where everything was accelerated. A lot of research was being pushed out that we could take these patients and get them back. And I don't know if you recall Jerry Rice. Jerry Rice had to get in that, I think it was a Super Bowl, and I can't remember which one. But he had to get back so quickly, and he actually fractured his patella or his tibial plateau because he got back too soon from his ACL reconstruction. I want to say it was 4 or 5 months. I can't remember exactly. So over the last 15, 20 years, we became really accelerated, but to the point now where the research is telling us, hey, we actually need to slow it down a little bit because failures are occurring, blowouts are occurring in the back of the knee. So we really can't push these folks, whether they're a professional athlete or not. We can't push them that fast. So you're right. I think we went up so quickly, but now we're coming back just a little bit. But compared to where we were 30 years ago, 25 years ago, it's still, professional athletes will be back in a year. But that first step, whether you're a basketball player or a hockey player, that first step really isn't there till about a year and a half, 2 years. So.
I got one more, Pete, because I know I cut you off earlier.
Go ahead.
Okay. And you mentioned, Paul, you just mentioned the number that I was thinking of, because I remember reading somewhere there was a list, on Google where they, like, really the first tracking of an ACL injury in the NFL was like in 1969 or something like that. Now you can't tell me that somebody didn't have one up until that point. It's just, do you find that in your business? I mean, I don't know how much you've looked at the history of things, but what were athletes doing in the 50s and 60s when things really started to ramp up with professional sports? I mean, they're Mickey Mantle, just wrap it up and go out there and play, you know.
Yeah, I think if you have an unstable knee, there are some sports where possibly you can get by. But for the most part, once you have instability within a joint, you're done. You cannot cut on that joint. You know, you can try your best. And I think you see the lives of Koufax, Bobby Orr. You know, these were great athletes who weren't able to play that long because of injuries that now, you know, they would have been unable to play, 15 years. You know, Bobby Orr had cartilage issues, and meniscal tears, and from all accounts, and you know, those are relatively easy to take care of now arthroscopically, and you know, and we know a lot more. I mean, guys aren't throwing 300 innings anymore. You know, the guy throws 200 innings, he thinks he's, you know, Carlton, or and it's just not occurring. You know, so we're able to preserve their lives, preserve their careers. And we're able to keep them relatively healthy. And if they do get injured, they're able to get back and you know, and work on their contracts. So I think back then you have to remember that guys, you know, I think a lot of the Bruins at the time here in Boston had summer jobs up on the North Shore, and you know, so they really, you know, that to play hockey was everything, and they tried to do whatever they could, but once they failed, they were done. Now guys have guaranteed contracts. They get the time to rehabilitate. The medicine is behind them to get back on the field, and they can have great careers even after being injured. So.
Yeah, well, because back then, if they didn't play, they didn't get paid.
Correct.
You know,
Yeah,
and like you said, they had, like, hockey players had summer jobs because the salaries weren't enough to sustain them throughout the year. Yeah, so yeah, I'm sure they played through a lot of injuries that shortened their careers.
Yep, absolutely. Yeah, it's changed a lot, and athletes are very smart now. They know. I mean, heck, we got, you know, we got the internet. They come in, they know their anatomy, they know outcomes, they know guidelines, they know protocols. So you can't fool anyone anymore. Not that you're out there fooling people, but people are well versed and well educated when they come in the door. So, which is great. It keeps everyone on the same plane. There's a lot of transparency, and you're still doing your best as a provider, as a practitioner, to get them, you know, to the end point.
So who does the pushing? You or the patient, or you only push as far as you can until, I mean, as far as rehab, say if I'm a patient and you push me, we're doing something for 5-10 minutes, and I say I can't do anymore. Do you just say, well, let's do a little bit more, or do you let it go, or how? I don't know how does that work?
We have to assess how, you know, why that's occurring. So if a patient is having issues with a joint, you know, we understand how these joints progress. And when a patient is having an issue post-surgically, that's a red flag. So, you know, once these surgeons do their work, you typically have a good joint to deal with. And working post-surgical patients is a whole lot easier than someone who's trying to deal with an injury and stay out of the operating room. Those are the ones that are tricky. Those are the ones you really have to be patient with. But the surgical ones, the joint stabilized, you're allowing the wounds from surgery to really mend. Those are the ones that are kind of, I don't want to say straightforward and easy, but you know, they're a little bit. We have a clear vision of how those patients are going to progress. So, but you don't. We have. I think if you're a provider and you have pushed a patient beyond that physiological limit, you have probably failed. And I don't, you know, I think we've all failed. There are surgeons I know that fail. There are physical therapists that fail. There are trainers that fail. So that's part of the job. That's part of educating yourself, of knowing, you know, when to say no and knowing when to go. So
now, long term, Paul, after they get the okay from you, okay, do you send them home with a schedule or routine that they should follow to keep on strengthening as they go? And do you do follow-ups?
Well, so as a physical therapist, day one, you're setting up a plan of attack. So they come in the office. If you're coming in for a neck strain or a rotator cuff initial tear, you're setting them up with a program that they can go home with that day of range of motion, strengthening, postural adjustment, things that they know nothing about. So you might give them 6 to 8 to 10 exercises of things that they can do in the home, and that's going to accelerate their progress. So, and those things are changed as you go through therapy. Now, when a patient's discharged, it depends on who they are. I mean, if they're going to go back and just golf, then yeah, you give them a few exercises to keep going. But if they're a college athlete, they're going to go back to their trainer. You're going to probably communicate with that trainer. If they're a high school athlete, you're going to communicate with the trainer or their strength and conditioning coach, and you're going to just tell them, hey, they've done X, Y, and Z. Why don't you start doing this with them or introduce that with them. So that's kind of our job, is to be somewhat of a liaison between the operating room and then back to their trainer or strength conditioning coach. And then really those guys are exceptional in what they do. And they know exactly where to take it from here. Our biggest job is really from the time they leave the operating room to the time they get ready to go back to sport. So.
I know you can't tell us because of the HIPAA thing, but you have worked on professional athletes in your office, correct? From your area?
Oh, sure. Yep. We've had professional athletes, we've had college athletes, we've had everything in between. People who are getting paid for doing what they do, and also athletes who were trying to get back. And that's the difficult thing, because in sports you are cut, just like we're all cut at one time. And some of these guys are cut because of injury, and they're no longer being taken care of by the teams. And then they try to reach out to local practitioners who know what they're doing or who have a history and are able to somewhat rehabilitate them and see if they can get back to playing sports. So, but yeah, we've been able to put our hands on just about every level of sports, every level of athlete.
So,
however, we'll understand. Most of your 95% of your athletes are taken care of by the team. They have great trainers, great therapists, great sports conditioning physiologists, surgeons. But you will see patients who don't want to have their surgery with their team doc. That happens a lot. Whether it's take Dr. Andrews for example. I mean, someone's going to have a Tommy John or a cuff. They'll see their team surgeon here in Boston, but they'll fly down to Florida and see Dr. Andrews, and Andrews will do the surgery. So, and then those folks might follow with Andrews' therapist down in Florida. So, there's a lot of money on the line here, and they listen to their agents, they listen to other of their colleagues, and they follow who the best folks are in business. So. You see less and less, if you're in private practice, you see less and less of the current athletes coming in.
So let's back up a little bit. A lot of people don't know, because we're talking pro athletes now, that you actually interviewed and was a finalist for PT, the head PT dude at Cleveland Cavaliers some years ago. Why don't you give us a little insight on that?
Well, I'll give you as much insight as I can without.
And why you made the decision not to stay?
I think in any, I can tell you exactly the reason why I stayed. I think in any business, it's relationship. It's you have to be good at what you do, but you have to have a foot in the door. And whether in my business, you have to know a bunch of surgeons, because surgeons are, I don't want to say the lifeline of our business, but they're the ones that are cutting, and they're the ones that want those athletes or those patients being taken care of by ex-physical therapists. So I became friendly with a surgeon who knew someone at the Cavaliers, and he called me one day and said, "Hey, the general manager of the Cavaliers is going to be calling you, and wants to speak with you about their position." They were trying to restructure their whole medical team. They were aligned with the Cleveland Clinic, which is a world famous institution.
Mm-hmm.
But I think there were some issues at the time, and I was all ears. So I flew out to Cleveland and had a great day with this general manager, and was well, it was a lot of fun. But it came down to me potentially leaving Boston and leaving a business that I had started, 2 leases. So it became almost impossible to leave. But I really thought about it. But push came to shove, it never happened. But I will tell you this, and I don't know how many listeners you have, but the one thing I remember about that, a couple things I remember about it, but the one comment I remember from this general manager, he said, and LeBron was with the team. I'm not going to joke about that, but LeBron's been with a couple of general managers, so you can figure that out. He said
that'd have been
That's
reason
another
enough for me
story.
not to take it.
Yeah.
he said, if you come here, LeBron may not speak with you. And I said, we were sitting at lunch. I said, what do you mean? He said, he's a very private person. He has to gain people's trust, and he probably won't talk to you for many months, or won't even let you treat him for many months. And I find that, again, we're dealing with $1 million athletes who really know who they trust and who they want to take care of them. And I respect that. But it was interesting to hear it firsthand that these athletes really, they have a very short window, and there's a lot of money on the line. And, they really want to make sure that they trust the person who's putting their hands on them. So, but
makes sense.
yeah, I can't, I respect his decision. I respect that idea, so, and hey, LeBron's had a great career. So,
Somebody's
but no,
doing
I'm glad that it didn't happen. Professional sports, I will tell you, is not all what it's cracked up to be on the medical side. General managers come and go. They fire surgeons quickly. They move staff out like cattle. So you want to give up something that you've created for that glamorous job that might not be there in 3 years.
So, Paul, I want you. I know you probably didn't know I was going to ask you this, but I'm going to ask you anyway. I want you to tell us a little bit about a patient, Michelle Mahoney, if you can. Yeah, I know. Very special patient, from what I understand. I watched the videos and everything else, and that day changed her life, and then you made an opportunity happen. And just talk to us a little bit about Michelle Mahoney.
Yeah, Michelle. So after, hey, I went to the Sox game that day, and my wife and I were down at a bar in Kenmore Square, which is a intersection just outside Fenway Park. And I mean, everyone knows the whole story, but suddenly people were moved inside. Suddenly we thought a gas garbage can exploded down at the finish line. And, about 20 minutes, an hour goes later, and all of a sudden it's we understood what took place. So this town was really upside down for that whole week. That was a Monday. by Friday they had actually, captured, killed and killed one guy and captured the brother. People were donating all kinds of money. I mean, people in this town are outstanding. And I, they really opened up their hearts to the survivors, and to the medical staff of the hospitals were outstanding. But as a private practice, I thought to myself, how can I help? How can we be? I mean, I could have donated a couple $1,000, but I wanted to do something that would be more meaningful. And so we put out this pledge that any and all victims we would take care of free of charge, nothing out of pocket, no worry to them. And I, a lot of the people that got injured, I mean, the Boston Marathon's it's a race that brings people in from all over the world. So, not knowing who was injured or where they were from, they were probably going to go back to their hometown to get a rehab. But about 2 months after the race, we got a phone call from a lady who said she was injured, and wanted to know a little bit more about the pledge. So, long story short, Michelle came in, and I didn't know who she was. But I quickly learned her story, quickly learned about her experience. And we spent the better part of the next 9 months to a year together, just trying to get her back, to a more functional level. And it was, you talk about one of those patients that in your life that you find meaningful. And she's one of them. I've got plenty of patients, but she's near the top of the list because of what took place in Boston, and the relationship that her and I had during those many months, and hearing her story. And I'll tell this, I've told her this many times. She never cried. She never, she thought that was a changing part of her life, but I don't think she was really, and maybe I shouldn't speak for her, but she never was really upset or mad about the whole situation. She just took it in stride. And boy, she taught me a lot about about forgiveness, because I think any one of us could have been really upset if that happened to us. And but she took it in stride. And my wife and I we stayed in touch. We went to her wedding. She got married. She had been dating a guy just for a few months after that. She was dating a guy just a few days, I think, before that, and she ended up marrying him. So we went to their wedding. So Michelle's become a real a friend. So
was she? I mean, I've seen the videos, but she reached out to you 2 months later. Now, was that fresh out of the hospital, or was she trying to do some other rehab and realize maybe I need some extra help? Or
I think most of those victims were hospitalized for a long time. I can't remember if it was 2 months or 3 months. It might have been closer to 3 months. But she did reach out to us, and but most of them were hospitalized for many, many months. So I can't remember her particular situation, but yeah, when she did reach out, we got her in and we got her going. So
it's a
she
great,
was a lot of fun.
Really great story. So do you keep in touch with a lot of your clients? I mean, a lot of them become friends now, or are they just acquaintances, or how does that work? Because
the fun thing about my job is that you go see your surgeon, you see your primary care physician, you see him once a year, twice a year, and that's that, right? You don't even get to know them. Patients come to see us 2 to 3 times a week, for 6 weeks, for 8 weeks, for 3 months, for 6 months. They get to know my whole story. They get to know where I'm from. Of course, they have no idea what Fort Covington's like. But we get to be friends, and some become part of my life. Some become really good friends. And it's no lie that my wife was a patient. So and it's one of those things. I'm a people person, so it's very easy to be to become friendly with people that you see, frequently. Some of these patients are in their 70s. They've been patients of mine for 25 years. They keep coming back for a total shoulder, a total knee, a total hip. They send their wife, they send their husband, they send their daughters. I get to know their family, that's really, I think starting this talk with you guys, you talked about sports, but I think over the past 10, 15 years, I've realized that, professionally, I have a bigger play than just taking care of one athlete. I have a chance to take care of a lot of patients who really value our care, and that's where it's become more meaningful to me to take care of the 65-year-old guy who just had a total hip, and see him get back playing basketball or playing tennis, because that's his passion, that's his love. So to me, that's I've if I'm ever asked to work for a team, I would have to think about it, because you give up a lot of your family life. You give up a lot. It's more for the young guy. But I really enjoy taking care of my patients, no matter what age they are.
Go ahead,
Paul.
Billy.
Well, I don't know how to follow that one up, because this one's really just kind of changing the direction a little bit. But one of the injuries that you don't hear of too much up here where we live in the North Country, but I'm assuming that you deal with it, is Tommy John surgery and therapy for pitchers who suffer that injury and then get the resulting surgery.
Yeah, so I've taken care of professional athletes, college athletes, and high school athletes, all who have had Tommy John surgery, which is ulnar collateral ligament reconstruction. That's the medial elbow, and they're not as easy as they make it sound on TV. I think when you look at the numbers, and there's a great book written by Passan, Passin, the baseball writer.
Yep, Jeff Passan.
It's called The Arm. And if you ever get a chance to read it, it's all about Tommy John. It's all about how young kids at the starting in Little League and moving all the way up through travel ball, where these kids are pushed to the limits, and they get their Tommy John in high school, and it's almost like they want to get the Tommy John out of the way, because once they get that elbow stabilized, they think that they're back on the field and back, and you hear these reports, oh, I've added 2-3 miles to my velocity, I'm now throwing 95, I'm not throwing 92 anymore. And I'll be completely honest with you, that's not the case. The numbers are not there to support the success of that surgery. There's a lot of guys having Tommy John, and they just don't make it all the way back. Now, some of the pro players, I mean, Chris Sale just had it done. Hopefully, he's back with the Sox. But there are guys that just don't get back, and they're not quite the same. But yeah, it is it's fairly common in the baseball world and the sports medicine world, but you really only see it with throwers, and you only see it with throwers who have a shot, or who want to play collegiate ball, or have that shot at the major leagues. I mean, if you're a 27-year-old guy with instability in your elbow, you're not going to get a Tommy John. It doesn't make any sense. But if you have a shot, if you're 22 and you're coming out of Texas A&M, you're going to want to stabilize that elbow and try to make it. So, but yeah, we do see those not as frequently as you would think.
I get two parts to that on. Number one, Joe Schmo, Pete Ghostlaw, gets that injury at his age.
Mm-hmm.
He can live. He's fine. There's no need for that surgery.
Completely fine.
Okay. And number two, what about softball pitchers? Are you seeing that increase at all, or or how prevalent is that with windmill softball pitchers?
You know what? That is a very good question that I don't particularly have the answer for. The stress on the medial elbow happens, here. And I guess the mechanics of throwing a softball is different. And I haven't, I'll be honest with you, I haven't studied that. So I don't know what the prevalence of a Tommy John procedure or ulnar collateral ligament damage is to an elbow softball player. I'm sure it's there. They might get other types of injuries that are more frequent with softball, but I don't know that answer. I don't know if it's that common
and I bring it up because we had a softball coach on a couple of weeks back, and one of his pitchers who's now moved on to the college level suffered this injury, and that was like I'd never heard of a softball pitcher getting it.
Yeah, I have not either. That doesn't mean it's not occurring. And I go to conferences and talk to many surgeons, and it's brought up. Softball injuries are not really. They talk about baseball. They talk about the overhead athlete because the mechanics of throwing overhead. But I can't imagine that it's, throwing underhand is that much different. But it's not studied as much, or maybe it's just not as frequent. So, but you're going to treat them the same way.
Right.
You're going to treat them post-surgically the same way.
Right.
But get that book. It's a great read.
That sounds it. Well, and I follow Jeff Passan. I'm a big
Yeah.
baseball guy. I follow him on Twitter. So yeah, I will.
Yeah.
So
It's startling, not to go off on a tangent, but seeing that I just left a Little League game. Little League has changed. If you want to talk, I don't know how much time we got. If you want to talk about how Little League has changed since we played, I could pitch on Tuesday and pitch on Friday and pitch on the next Tuesday, and it's like now it's. And I tried coaching last year, and I got frustrated because I had to count pitches, I had to count, had to move people around. It's become I felt more like I was driving data than I was coaching. And I just wasn't made out for it. And because I was more in the strategy of the game than I was counting pitches. But they are counting pitches now. They are counting a lot. And you have to enter it into the system. So it's all for the benefit of the kid. The only problem with it is that the kid that plays club baseball is not following Little League rules. So little Johnny might pitch on a Tuesday in Little League, but on the weekend, Saturday, Sunday, he's playing in his club baseball game. And so we're tracking that kid during the week, but I don't know who's governing that kid on the weekend. So that's why you're still seeing high school kids blow out their elbow with a high frequency, or first year college or first year pro kids still blow their elbow out. And you're thinking, wow, if I thought we managed these well, but they're getting around it. They're traveling and they're playing a lot of baseball still. So
that was one of my questions was going to be, so they're basically the kids that are hurting themselves at a young age are because of abuse, because they're just being thrown so much. We didn't see that when we didn't see that when we were young. I mean, we went to a game. If you were the best pitcher, you pitched, and you pitched three games a week. So things have changed, and I understand about the counts. Yeah.
Yeah, like all you guys know, a guy that throws 200 innings, 210 innings, 220 innings is like a dinosaur now. He's the anchor man. A guy that throws 7 innings, wow, he went 7, and it's just you don't see it anymore. A guy goes 5 1/3, he's out. You get your first hold guy, then you got a closer, then you got a setup man. You got all these guys making $4, $5, $7 million to get to the closer, and the game's changed. And but it starts way back when those kids. Hey, there's a lot of money in baseball, and those kids are trying to make it. And I don't can't blame them. But once you blow your elbow out, it's not always easy to repair and get back. I can tell you.
And just like all the sports, Paul, if you're focusing on one sport, then you're probably playing it at least 9 months out of the year, probably 9 to 12. So the overuse injuries have got to be just immense, I would think.
Here's an interesting, I was in a conference last year, and a guy threw up his PowerPoint presentation. And I think it was Andrew's physical therapist for many, many years. And he had a map of the country, and it was pretty unique. A map of the country with a line drawn horizontally right through the middle. So from the middle of California all the way to Maryland. And he said, where do you think the majority, above or below the line, which part of the country has more 200 game winners?
I don't know. I thought you were going to ask another question, but
more 200 game winners.
North of that line or south?
I'm going to assume south.
You would assume that.
Yeah.
Those kids are playing year round. Those kids are blowing out their elbow. The kids in the north can't play year round. So they don't have innings logged in their shoulders or logged in their elbows. Our mechanics are still developing as we get through 10, 11, 12, 13, 14, and our strength's getting there. But the kids in the south are playing year round. So just to your point, kids are playing year round, but not in Boston. You know, they'll play a lot. And club will take place indoors. But the kids in Florida, the kids in Texas and Arizona, you know, it's year-round ball, and that's where those. So the number of MLB game winners over 200 was greater in the north. It was very interesting. You know.
Well, and it speaks to our time growing up as kids. Our baseball season was mid-April, and if you played some Babe Ruth, you might get to August, but that was it, and you were done. Yeah. Just like all your other sports, you were done. Time to move on to the next thing.
But we still had guys like Tom Browning. We still had guys like Jim Deshaies who made it, and Browning had a hell of a career.
Oh, I'm not saying that deters anybody from having that chance, but I'm just saying back in our day, it was 4 months, and it was 4 months. It's not and that's all sports. Yeah. It's a 9 to 12 month season. If you can fit it in, it's 9 to 12 months.
The problem, and you started this saying I was a 3-sport athlete. You rarely see that now. You rarely see.
I'm sure down where you are, absolutely.
Rarely. I mean, if you get to high school and you may be a 2-sport athlete, but the kids that are going on to college, and I know my kids both play hockey, by the time they get to 11th and 12th grade, if they have a shot at it, they're probably going to go 1 sport, because there's just there's that much competition to play. So, but the days of three sports isn't is long gone, sadly enough.
So we're go ahead, Paul.
I will tell you this. I still think the best athletes that are making it are kids that play at least 2 sports, because they're recruiting, and most of your coaches, most of your surgeons, physicians, trainers, therapists are advocating for multiple sport athletes, because you're using different body tissues, you're using different joints. And you're typically a better athlete at the end of the day. I mean, you can go down the list, look at all the great athletes now. A lot of them played 2 sports.
So we got to wind down, but I just wanted to bring one more thing up before we close, and everybody has an input on this. You ready for some baseball or what? Because everybody seems to be having watched it the last couple of days. But
starting in a couple of days. I'm ready for all of it to continue. I'm ready to take a mask off. I'm ready to live my life again. But I think we got many, many more months to go with this. But yeah, baseball is 2 days away, I think, on the 24th.
Tomorrow is Yankees. Yankees Washington tomorrow.
Oh, okay. So I guess I forget about those pinstripe teams. But the Sox open up on the 24th, and but right on the backside of that, we got the NBA and the NHL coming, and I'm excited about all that. So it's hopefully these guys stay healthy. Hopefully they stay within the bubble, and we're able to have a great month of August and September to close things out. So
sounds good. Well, Paul, we want to thank you very much for coming on the program.
Oh, thank you very much. Nice to get away.
a little education for the rest of us. So we really appreciate it.
Yeah, very much.
Hopefully I educated you a little bit, but typically it's the reverse. So.
Well, we appreciate it. That's going to be it here on
Thank you, Paul.
ESS Empire State Sports and the Wise Guy Sports Talk Show with our host, Joey Ream, Dave Bartlett, and myself, and our special guest, Paul Ghostlaw, saying good night, everybody, and stay safe.
Good night, guys.